that, I think we can start. Well, welcome everyone. We're so excited to have you with us today for the Building Community Pathways to Family First Prevention Services, partnering to redesign the family engagement and service delivery context webinar. Again, we are so excited to have you here with us today. We're going to start our time as we often do with the land acknowledgement. So every community owes its existence and vitality to generations from around the world who contributed their hopes, dreams, and energy to making the history that led to this moment. Some were brought here against their will. Some were drawn to their distant homes in hope of a better life. And some have lived on this land for more generations than can be counted. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this webinar by acknowledging what has been buried by honoring the truth. I am in Charleston, South Carolina, and I would like to acknowledge that this webinar for me is being held on the traditional lands of the Kuso people. And I pay my respect to elders both past and present who have stewarded this land throughout the generations. And if you all are interested in learning more about the lands that you are on, we will make sure that we place the link in the chat so that you may do so as well. We also start our time together with the promise of community action. So again, feel free to say this with me out in your offices or at your home, wherever you may be. Community action changes people's lives, embodies the spirit of hope, improves communities, and oops, that's one. Hold on, there we go. Embodies this. Let me start over. Sorry about that. Community action changes people's lives, embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we are dedicated to helping people help themselves and each other. I am Lily Seals. I am the Director of Practice Transformation with the National Community Action Partnership. And once again, I want to welcome you all to this very exciting webinar. We're just going to review a little bit of what we're going to do. Of course, we're going to have our welcome and introductions. We're going to give a little bit of background about the collaboration between NCAP and Chapin Hall, who are our presenters for today. We'll have a presentation by Chapin Hall, and then we'll have a Q&A and resources and upcoming events. So Chapin Hall, so we just want to share a little bit about Chapin Hall, just to kind of set the stage for you all. So Chapin Hall provides public and private decision makers with rigorous data analysis and, and achievable solutions in supporting them in improving the lives of children, youth, and families. These areas include child welfare, community capacity, and youth homelessness. In terms of our collaboration, about over a year ago, Chapin Hall and NCAP leaders started talking about how they could work together to support systems and community leaders to come together and work in new ways that deliver better results for families. We have been considering what we each know about working with public systems and communities and how we could bring our knowledge and experience together to help local child welfare leaders and community action leaders work with grassroots community leaders in new ways that puts community in the lead. So this webinar today is one of two sessions we are offering to help deepen the community action understanding of those opportunities, focus in the vision emerging from the child welfare field at both the state and local levels. So today we are again just really excited to have Dr. Krista Thomas, who is a senior policy fellow at Chapin Hall. Dr. Thomas leads blended teams of policy, practice, and research experts in efforts to build the capacity of state and local human service systems across the country to execute large-scale transformation initiatives and improve outcomes for children and families facing adversity. Before she takes the stage, we really want to learn a little bit more about who's on the call with us today. So with that, I'm going to hand off to my colleague, Karis Manus.
Thank you, Lily. So I'm going to share my screen now. We have a poll for you. Hopefully you all are seeing the screen now. There's a QR code that you can scan with your phone. We will also put the link and the code in the chat for you. So our first question, there's the QR code and the code that you can enter in once you've got menti.com pulled up. Our first question for you is, which description best represents your role at the Community Action Agency? So are you an executive director, CEO, a program director or manager? Are you a case manager, coach, or family advocate? Maybe we've got some intake specialists or resource navigators on the call with us today. We just want to see who is joining us today. What is your role? So those are coming through. It looks like we've got a good amount of program directors, case managers, or coaches on the call with us. All right, and other, if you've got an other, if you want to share with us in the chat what your role is, you're welcome to do that there. Okay, looks like those are starting to slow down some now. So our next question is, what is it about the topic today that caught your interest and motivated you to join the webinar? So what is it that drew you to today's webinar? What is it that you're looking forward to? Learning about family first, child welfare, learning to help with family engagement, interested in learning more about families first. A lot of interest in that. Okay, family interventions, strengthen systems, community action agency, and child welfare together. Okay, great. Thank you all for taking the time to share with us, and you all are welcome to continue engaging in the chat as we continue with today's presentation. Thank you again. And with that, I'm going to hand it over to Krista. Thank you so much.
Thank you so very much. Hi, everybody. Thank you for coming to this webinar and joining me and this fantastic group of folks for an afternoon discussion on community pathways to prevention services in the family first context. I'm going to start sharing my screen, which I thought I was doing a second ago, recognizing I didn't. Can everybody see my screen now? Are we good? Perfect. And before we really shift to get more deeply into the content around family first and the community pathway conversation and what that means, I think it's important to take a moment and just reflect that we are in a moment of pretty substantial transformation in the child welfare space. There are advocates, leaders, policymakers, child welfare decision makers across the country that are recognizing that we are really in need of some profound system transformation and redesign, and to create a system and a service delivery context that works better for families, that is more responsive to families' needs, and is better positioned to promote positive outcomes when the system that we have right now often does not do that. And I think many of the things that we're going to talk about today are right in line with the values and the commitment of community action agencies, and particularly thinking about how we can invest more in community and build community partnerships and pathways to prevention service delivery. Before we start talking about what the future can and should look like, I just want to take a quick walk through the past and talk a bit about how we got here. and the policy framework that we're working within, and basically how we've created the current paradigm that is overarching child welfare service delivery. Now, I'm not going to do a whole big long historical policy lecture here, but there's three themes that I'm going to want all of you to walk away. One, that we have established a policy framework and created a system that invests much more heavily in foster care than it does in prevention. And we've ostensibly created a foster care system and not one that's really focused on maltreatment prevention and family preservation. Two, we have purposefully, by design and policy, separated and consistently separated programs and services and policies that are designed to address child maltreatment from programs and services that are designed to address poverty. Even though we know that many of the families that are entering into the child welfare system have a variety of concerns, many of which are experiencing poverty-related stressors that contribute to child welfare system involvement, and the programs that we've created have separated those two on purpose and by design. And third, as we think about the policies that we've established, there have been a tremendous amount of inequities and differing experiences that Black and Brown families have experienced as a result of these policies, and that has come up time and time again. So, quick walkthrough here's the very first child welfare program that was ever established for mothers' pensions way back over 100 years ago, because it was recognized that many of the families that were coming to attention to the child welfare system or that were needing help where children's safety was compromised was because of poverty-related issues. And so mothers' pensions were created to provide some financial support and promote some family stability. Now it's important to note that mothers' pensions were primarily available for white widowed women, and families of color were largely left out of that program. Interestingly, many of the policy architects over the mothers' pensions were the early creators of the Aid to Families with Dependent Children program, or AFDC, which then became the Temporary Assistance for Needy Families, or present-day TANF. What's interesting to note about that is that the architects of the AFDC or ADC program, it was originally called, were also the early leaders of the Children's Bureau. And when those policies were established in law in the 1935 Social Security Act, even though it was the child welfare leaders that created that original Aid to Dependent Children program, the decision was made to put that in the Social Security Administration and to put the very first child maltreatment prevention programs in the Children's Bureau. So that separation occurred. This is relevant to where we're going with the story as we're trying to think about building community pathways to prevention, that we want to be thinking holistically about the types of services and supports that families need, and not really keep these conversations. Moving along, we're moving on a couple of decades ahead. Now we're in the late 1950s and 1960s, and it's coming to the attention that there are a lot of families that are being denied Aid to Families with Dependent Children benefits, primarily Black and Brown families, because homes were determined to be unsuitable and not deserving of these programs. This raised all the way up to federal policymakers who recognize that we can't really do that. That you either need to provide the services to which families are eligible, or we need to remove those children and place them in foster care. What happened directly after that was that there were a set of amendments to the Social Security Act, which made foster care an open-ended entitlement program, kind of thus establishing the policy framework that we have today, where the majority of federal funds goes to fund foster care. Now, at this point, we don't really have the child welfare system that we have currently. It's still relatively small. There's not a whole lot of families that are involved with it. Well, we move forward into the 1970s, child abuse becomes a public issue for the first time. The Battered Child Syndrome is published by Dr. C. Henry Kemp. Things go to Congress. We get the landmark legislation, the Child Abuse Prevention and Treatment Act of 1974, which is really the hallmark of the child welfare system that we have now. Now we have mandated reporter lines. Now we have requirements for hotlines. Now we have a lot more families coming to the attention of the child welfare system than they ever have before. And it's really the foundation of what we have now. The system grows and skyrockets.
Thomas.
Yes,
Sorry.
ma'am. Sure. Can you hear me?
Yeah, they're saying they're having a little bit of they're having some issues hearing you. It sounds kind of like you're breaking up in between words.
Oh gosh, this happens to me sometimes. Let me do a quick, I'm going to switch to phone talk amongst yourself, and I'm going to hurry this along a little bit. So give me 1 second.
Okay. And everyone, again, I know that we have some new people who've joined us. So again, we would love to know your name, what state you're from, your organization. Again, we would love to see that in the chat. I know we saw Georgia and Maryland. But again, so please feel free, particularly for those who have just joined us. I see Virginia, New York, Missouri. So please place that in the chat for us as well, because we love to know our agencies and our states that are with us today. So thank you so much. California, thank you so much. Of course, Arkansas, North Carolina, familiar with Fayetteville, North Dakota. Thank you so much.
Okay, how's this? Is this better?
Is that better for everyone? You can give a thumbs up with an emoji or place that in the chat. Is that better?
How are folks hearing me now?
I think that's better.
Is that better? Good.
Yes.
Well, I'm sorry you missed my likely getting belabored historical policy lecture, but I'm glad that folks can hear me a little bit now. I'm telling the story because I want to try to create the pathway to show how we got where we are, how we've made the decisions about how and where we invest, how different families have experienced the establishment of the current child welfare system, to really lay the groundwork for how and why we need to create a new one. I think many of you may have missed some of the details that I started with, but right now I'm kind of at the launch of the current child welfare system that we have now. Now it's the 80s and 90s. Foster care has skyrocketed. We now have hundreds of thousands of kids in foster care, disproportionately Black and brown families. And we're recognizing that we need to do something about this, and there becomes a lot more attention and focus on permanency, and largely permanency that is, the adoption or guardianship, not necessarily reunification. So we've got a little bit of investments in the 90s through the Family Preservation and Support Program, but this is very, very different to the level of investment and resources that are being placed in foster care and family separation. I'm going to step that all up to the Family Prevention, or the Family First Prevention and Services Act, which passed in 2018, which was arguably the most transformative piece of, there it goes. Is everybody safe? Did we pass the test? All right, good. Oh my God, what was I saying? Oh, arguably transformative piece of legislation since the Adoption and Safe Families Act in 1997, which focused so heavily on permanency and termination of parental rights, that we now have this pretty momentous piece of legislation through Family First, which for the first time opens up a Title IV-E reimbursement for prevention services. Never has Title IV-E, which is the largest federal funding stream for child welfare, ever been used for services of any kind, but it opens up for a reimbursement for prevention. Now, what's important is that it maintains that distinction. It's for prevention services that are evidence-based in the areas of parent capacity building, mental health, and substance use. And I'll talk about that a little bit more in a minute. But what I want to lift up is that while it's fantastic that there's now these federal dollars, reimbursement dollars available for prevention, it's maintaining that same traditional kind of deficit-based, pathology-based child welfare paradigm, where it's services that are designed to observe deficits with parents and doesn't necessarily provide resources or specific effort on other circumstances and characteristics that could be putting families at risk of system involvement, specifically poverty-related root causes. I want to set this up because as we think about community-based pathways to prevention and all of our opportunities to think about how we can create service, access, and delivery mechanisms that are holistic and responsive to the full range of needs and circumstances that might be putting families at risk of child welfare system involvement, potentially compromising child safety. A bit more along that line, I just wanted to give everybody a sense of what the funding landscape looks like for child welfare. In 2020, which is the most recent data that we have available, this is from a report published this year in 2023, there were about $31.4 billion of total direct public expenditures for child welfare. If you look kind of down that visual, you can see that still now the vast majority of resources are going toward family separation through out-of-home placements and permanency with that's not reunification, through permanency options like adoption or guardianship. There's still a pretty heavy investment in the investigations process and child protective services, and a very low amount of resources comparatively that's invested in prevention. We're starting to see it go up a little bit more on the state side to 16%, but still, as of right now, only 11% of federal resources are going towards prevention. It is relevant to note that since the passage of Family First in 2018, we've seen a $1.6 billion reduction in total spending, and so that will be a trend that we're going to want to keep our eye on. But what I want to just lift up here is still the significant investment in foster care, the kind of reinforcement that what we have as a foster care system. And then we're thinking about how we want to leverage the opportunities and flexibilities that Family First presents, is to think about how we can be tapping into these resources to try to build more of a prevention-oriented system and to build our capacity to serve families much earlier in advance of family separation and on foster care. Title IV-E, which is the funding stream that we're going to be talking about more today, is the largest federal funding stream for child welfare activities. And the majority of that goes towards foster care and adoption and guardianship assistance. And right now, still a very small percentage that is being tapped into and directed toward prevention services. So a little bit more on Family First and what it is, and importantly, what it isn't. It is a pretty large piece of legislation with a lot of provisions. Each one of them could be its own webinar and own set of conversations. We're going to talk a lot today around the prevention provisions, which seems to be the one that hits the most play, and it's one where we get the most energy and inspiration for change. Included within that is the focus on expanding access to evidence-based services for families and making reimbursement available for evidence-based prevention services. There is a heavy focus in Family First on reducing the inappropriate use of congregate care and reducing the federal financial expenditures that are available for kids that are placed in residential care, unless certain criteria are met, namely that the children have a clinical reason to be in residential and are not just being placed there for lack of any other option. And also to ensure that the residential facilities meet a pretty strict degree of criteria around the quality of service. And that is a pretty substantial change with pretty significant financial repercussions for state child welfare agencies and the funding that's available. So that's a whole other conversation and realm of practice improvement. There's also a really exciting and important thread around supporting relative and kin caregivers that weaves its way throughout all of Family First. One, kin are a eligible recipient for the Title IV-E prevention services. Family First also, for the first time, makes federal reimbursement available for evidence-based kinship navigation programs. I think that's also something that may be relevant as we think about how communities can better serve kin and think about implementing and scaling up kinship navigation programs, which provide connection and resources and supports, sometimes economic and concrete supports, connection to respite, benefits navigation, depending on the different models, a whole range of supports for relative and kin caregivers that are taking care of their relative children, whether they are in or not directly involved in the child welfare system. And that's another exciting thread that we're happy to go back to, but is also something that Family First makes available. We talked about the three categories of prevention services for which 4E reimbursement is available for states. There are reimbursement available for programs focused on in-home parent skill building and development, evidence-based programs focused on substance abuse treatment and prevention, as well as programs designed for mental health treatment. For programs to be eligible for federal reimbursement, they need to be rated and favorably approved by the federal Title IV-E Prevention Services Clearinghouse. Like everything since Family First passed, this has been a plane that's been flown while it's getting built, like much of the work that we do. And over the 5 years, the Clearinghouse has worked hard to rate and improve and add more programs. But the reality of the implementation context is when it's taken a minute to get the Clearinghouse up and running, In the very beginning, when states were building their family first plans, there were very few programs to choose from, and it's been building over time to add more programs across these three areas on the clearinghouse, and also considerable efforts in the field to continue funding evaluations and trying to grow our still relatively small evidence base when we think about the range of programs that are available in child welfare. Now, it's important to lean into a bit both the opportunities and the challenges that Family First presents, because there is both a lot of opportunity and flexibility, but there's also a lot of kind of tension and challenges and lines that we have to walk. And it's not always really straightforward, and trying to navigate through some of this information is really incumbent on community leaders, lived experts, child welfare leaders, partners coming together to think about how best to take advantage of this policy opportunity in the context of any given state or any given local jurisdiction or community. What makes Family First super helpful is that it really is now transforming our focus more from foster care to prevention and increased family stability, and providing significant federal resources to back that up. So I think if implementation and scale up of Family First has been a little bit slower than I think people would have thought, I think one thing we can say is that it has really galvanized the child welfare community and advocates and other leaders to really be talking about prevention in a much more focused way and shifting the conversation nationally. It provides us the opportunity to invest more in what works. I think it's great, right? We all want to be placing our investments in programs that we know have a demonstrated positive impact for kids, families, and communities. But we also want to make sure that those programs are responsive to the diverse groups and families and communities that we're serving, and how well is the evidence base that we have matching up with the unique needs of different families and communities that may be coming into contact with the child welfare system. But it does give us the opportunity to invest more in evidence-based practice and also continue to grow the evidence base. Family First also has a consistent thread running through it, elevating and reinforcing the need for trauma-responsive practice. And it's across all of the provisions, but specifically on the prevention side, it's a requirement that any of these maltreatment prevention services that are being applied to families need to be administered, but through a trauma-responsive lens. Now, it doesn't say more about what that is or what that means, and I think that's still a lot of the implementation work and the hard work that we have to do to define what that means and operationalize trauma-responsive practice with our partners, with communities, with families, but it is an overall expectation that that lens of trauma-responsiveness is consistently applied. Family First also creates opportunities to partner across systems to align prevention efforts. I talked a little bit earlier about siloing poverty-related programs from child welfare-related programs, but there's so many systems that are interfacing with many of the same families that we're talking about. Families experiencing housing instability, families needing childcare, families needing transportation, a SNAP, WIC, behavioral health systems, mental health systems. We've created this rather siloed and fragmented public agency service delivery mechanism, and we're thinking about trying to create more cohesive prevention plans. It really calls us to think about partnering differently and to be thinking about who's around the table very differently, and to work toward greater system alignment and integration. Family First also on the positive gives us the opportunity to think about, right? We talked about those investments where it's really heavy, foster care over prevention. How can we descale that? How can we descale the investments and that we're making in foster care and family separation and scale up and invest more in prevention and prevent the need for family separation, prevent the need for child maltreatment, and hopefully prevent child welfare system involvement from ever occurring to begin with. And where it's going to be the focal point of our discussion today is Family First provides the opportunity through some of the administrative dollars and reimbursement to build community capacity to serve families. I think we focus on the resources that are available, rightfully so, for the evidence-based services, but there's also Title 40 administrative dollars that can be leveraged to build community capacity, to work with families, administer Family First prevention services, and think about how we might want to grow our community-based infrastructure. So that's a lot of the good stuff. There's a lot of, I think, real stickiness that I just want to name off the bat, particularly as we get into the community pathway conversation, so we can sort through it together and think about implications and opportunities. The legislation identifies children that are eligible for preventive services using the word candidates. So children that are candidates for foster care. And candidates for foster care are defined as children that are identified in a child-specific prevention plan as being at imminent risk of entering foster care, and absent the provision of preventive services are likely to enter foster care. I did a pretty good job of quoting it. There probably wasn't a direct quote, but it was darn close enough. But you might want to check the actual language. But I raise this is really important because one, this imminent risk language still kind of continues this pathologizing kind of deficit-based lens, and it could be prohibitive to families voluntarily engaging in preventive services, and trying to think through how do we collectively comply with the legislative language and framework while trying to build non-coercive voluntary engagement mechanisms to sort through some of this is just something to put on the table. Yeah, we talked about the prevention services still focusing solely on perceived family deficits, and not necessarily focusing or making available financial resources for poverty-related root causes. And while we're grateful for the opportunity to invest more in evidence-based services, we still have a pretty significant dearth of culturally responsive models, models designed specifically with and for diverse communities, and there's still a lot of work to be done to try to grow the evidence base and the options to meet the needs of the very different families that we're serving across communities. Within this conversation, it kind of defaults to this traditional child welfare paradigm, while at the same time having opportunities to move beyond it and trying to think about how we partner differently and create different access points for engagement and service delivery that's outside of the traditional child welfare context, which is really what's bringing us here to this conversation today. And assuming we can work through all of it, all the philosophical, the ideological, some of the technical challenges, we got some logistical and infrastructure issues to deal with here too, as we think about what's it going to take to build community capacity and infrastructure to implement federal programs like Title IV-E, maintain data reporting requirements, and other issues. There's still, from at least the experiences that I've had in jurisdictions to date, still a great amount of capacity infrastructure that needs to be built. But this would be a very exciting conversation to have with all of you all today from the perspective of community leaders. All right, so I know we're going to take questions at the end. I've not been able to monitor the chat, but before we pivot to community pathways, I thought I might just pause and see if there's anything in the chat worth lifting up or any kind of general family first questions people wanted to talk through before we dive really deeply into the community pathway opportunity.
We do have a question in the chat about what is the timeline to grow the list of approved EBPs?
Sure. I mean, I think that's an open question, right? Like, people are actively working to grow that list. There's not an established timeline. The clearinghouse is a funded entity. They have a process for that involves external feedback and recommendations around which programs to prioritize in their review. There were some significant federal funding opportunities that came out this past year to fund additional evaluation, recognizing that we need to continue to grow this list and that resources are needed to do so. There's one other technical requirement that I didn't mention earlier, but it's relevant to this. The legislation requires, one, that there's a continuous quality improvement approach or an evaluation approach for the EBPs that states put in their prevention plans for federal approval, right? The technical way that it works is states have to develop a 5-year Title IV-E prevention program plan. That's the name of the federal requirement. Within that plan, they outline their goals and objectives and also list the evidence-based programs that they would like to receive federal reimbursement for, and their rationale and who they're going to serve and their implementation plan and all of that good stuff. If the program is rated as well supported, there's 3 possible ratings in the clearinghouse. Well, 4 really. The 3 that you want are promising, supported, or well supported, with the well supported rating indicating that you've got the highest degree of evidence. Not approved, and not rated is also an option, but that's not, that's not the grade that you want in your report card. You want to be, promising, supported, or well supported. If programs are rated as well supported, states have the option of requesting a waiver of the evaluation requirement for that program if they can put forward a credible, continuous quality improvement approach that shows their inherent capacity to determine whether or not the programs are being implemented with fidelity and achieving their intended outcomes with families. If the programs that states want to put in their plan rate at that promising or supported level, meaning they're not quite at that well-supported level rating, there's also a requirement for an evaluation. I bring that up here to the question about the timeline, is that it's almost built-in processes for continuing to generate evidence for these programs and hopefully move more of them up the chain, because states are required to resource an evaluation for any programs that they put on their plans that are not at that well-supported level. And you can imagine this is its own negotiation because that's a resource. That's another resource demand on jurisdictions. And while there is federal reimbursement to support up to half of that cost, the state still needs to come up with the other half. So it has impacted state decision-making around which programs to put in their plan and trying to think about how many evaluations they can afford to fund at any given time. But that's a lot of detail and inside baseball to answer the broader question of, it's a long game. The number of programs in the clearinghouse has grown increasingly longer over the last 5 years. The clearinghouse is still working hard to add more programs. So there's the process of how long does it take to review and rate and put programs in the clearinghouse, and the concurrent process of how can we keep funding evaluations and building more evidence and building more culturally responsive programs and trying to create more options so that the services that are available are truly reflective of the needs of the families that jurisdictions and communities are trying to serve. That's a very long answer, but hopefully it sort of got at what you were asking. Any follow-up or other questions about Family First in general? I only get to see a couple of faces, and most of you guys are likely eating your lunch, off camera. So give me a holler if you want me to keep on going into community pathways, or if there's anything more that folks want to stay in the general Family First arena. I'm going to ask Terry and Jennifer because you're the two that I can see. and I appreciate you bravely staying on camera and at least give me some visual feedback. All right, so let's talk about community pathways and what the heck I'm talking about when I say that. We talked about some of these requirements, but there are some inherent flexibilities that are built into Family First around who's eligible. States are able to define candidates any way that they want and determine who they want to serve via prevention services in their 5-year prevention program plans, and there's flexibility in the context in which these services are received. As we're thinking about how to do that, there's a lot of states that are thinking about how do we want to create access to prevention services in ways that look very different and that is outside of the traditional child welfare service delivery context, and try to create contexts that are a bit more responsive, receptive, non-coercive, and a more positive delivery framework for families. When I say community pathway, what I mean by that is any avenue, and these are starting to look very different across the country, any avenue that families use to access Title IV-E funded prevention services through Family First outside of the traditional service delivery and case management context. So you don't necessarily have an in-home service case. You're not necessarily under court-ordered supervision with a DCFS worker assigned to you. Can we create an access point that looks different than that? And there's a number of different variations, and any of those are what I mean when I say community pathway. Options that we're starting to see emerge include but are not limited to working with contracted community-based agencies, like perhaps community action agencies or family resource centers, or care management entities, as I talk about a Connecticut example that I'll share later on, where we have a community partner That's the one that's charged with engaging families, developing prevention plans. I'll talk through some of the specifics in a second, but it's not child welfare that's doing that. It's a community partner. So off the bat, that service arrangement looks very different, and hopefully a very different culture for families. There's some jurisdictions that are thinking about working solely with their evidence-based service providers to do all of the work that's associated with administering the prevention plan. Indiana is an example, our share. We're seeing this emerge in Indiana, New York, and some other places around home visiting, where home visitors are the folks that are charged with working primarily with the family and is the conduit to accessing the family first prevention services. Also starting to see jurisdictions think about how to deal with that fragmented service delivery system and build new partnerships with other public agency partners that are serving families that are coming into or may come into contact with the child welfare system. So establishing partners with departments of ending homelessness or partners with public assistance or TANF. Like how do we think about trying to get families connected to relevant prevention services in advance of the need for deeper child welfare system involvement, and to create an access point that occurs before child welfare ever gets involved. So these are just some of the innovations that people are starting to think about. How can we do this differently? How can we do this earlier? How can we do this in a different kind of culture, paradigm, and service delivery context? Right now, we got about 15 states that are moving in this direction. 5 states, Connecticut, DC, Indiana, New Hampshire, and Rhode Island, that are actively implementing community pathways. A number of jurisdictions, California, New York, North Dakota, that are readying and getting their act together and building some of the infrastructure, and a growing number of states. That number is probably bigger than what's on that slide even now, that are conceptualizing and thinking about amendments to their forward plans and trying to build some of these alternative service delivery opportunities. Now, why is this a good thing? Well, it can increase investment in community capacity to engage and serve families and bring more of those resources that have been heavily invested in foster care and try to use that to build community infrastructure and capacity. Can create an opportunity for families to access prevention services in environments that they know and trust, that are a little bit less coercive, intrusive than the traditional child welfare experience. To be able to get access to prevention services that will likely prevent child welfare system involvement before you ever even get involved in that traditional child welfare paradigm. There's a lot of flexibility in how states can do this, and that can help think about how we can reduce the footprint of CPS in families and communities' lives overall. And it creates really an opportunity to think differently about what those partnerships could look like. We've talked about partnerships between child welfare and public agencies, but also to think differently about partnerships between child welfare and community-based agencies like community action agencies. And how can we think about strengthening and expanding this prevention service array continuum and investing in strong community partnerships. Now, similar to and you can see the parallel between the broader family first conversation that carries down here into the community pathway dialogue as well. There's tensions to deal with. Like, how do we optimize this flexibility and create service delivery pathways that work for families, that work for communities, that are in line with our values, our ideals, the world that we want to be living and leading in, with the family first legislative framework and the technical requirements? How do we walk that, how do we walk that lens in a way that feels good for everybody, but still maximizes the flexibility that's there? How do we create increased access to prevention services to families that would benefit and want to receive them without increasing surveillance or facilitating unnecessary involvement with child welfare for families that otherwise would not have come into contact with the child welfare system? Like, how do we access these child welfare resources without actually increasing child welfare system involvement that wouldn't have otherwise occurred? There are some data requirements. Like every federal program, there's data recording requirements. They want to know how many families are getting the services, how long are they getting them, are any of them coming into care? There's a range of them. How do we collect the data that's required, that's legislatively required for the program, while still maintaining family consent and privacy? And there's some really interesting things that are going on as states are trying to build out their child welfare information systems, thinking about community portals, thinking about modular approaches to data collection and firewalls that limit who has access to what information. It can get really super technical, but also really important as we think about how we build the capacity to collect the information that's needed while still protecting families' identity and privacy in every place where possible. How do we do this work in a way that maximizes community agency and ownership and leadership over this work and family voice and leadership over this work while maintaining the required functions of the, I'll use the wonky word, the cognizant Title IV agency, which is the child welfare agency and the folks that's charged with administering those programs. They've got inherent roles and responsibilities in administering federal programs. How do we make sure that they are in a position to do that and fulfill that role, while at the same time still maximizing community leadership and ownership over what the programs look like, how they are implemented in the family experience? And then very similar to what I said about Family First in general, ensuring that we have the capacity and the infrastructure to be able to build and implement and sustain some of these programs. Like, to that end, I thought it would just be helpful to spend a couple of minutes talking about, well, what are the requirements? Like, if we're going to do this, what do we have to do, right? So the first part, you're thinking about identifying and determining who is eligible. We talked about there's these candidates for prevention services. So there needs to be some kind of process for identifying and engaging eligible kids and families for prevention programs, and then officially determining their candidacy. Now, that determination of eligibility for a federal program is inherently a federal role, and that needs to be done by the child welfare agency. However, identifying people that could benefit from services, engaging people that could benefit from services, collecting that information, all of that can be done by somebody outside of the child welfare agency. So there's ways to do that, where community partners and others can do all that work, transmit the information, that somebody inside a child welfare agency actually marks the button that somebody is eligible. It's kind of separating out what's the meaningful work from the technical, requirement. And I think I forgot to say something super important earlier. This is a bit off book, but it just occurred to me. Who's eligible to receive services are candidates, like the kids themselves, their parents, or their kin caregivers. So as we're thinking about who do we want to be serving, those are it's the child themselves that's identified as the candidate or the eligible recipient, but the people that can actually receive the services can be the children, it can be their parents, it can also be their kin caregivers. So as we're thinking about service or right continuum, I should have said that explicitly earlier. Forgive me for that oversight. I started with, so we need to figure out how to identify, engage, and ultimately determine candidacy. That determination part is a government responsibility. There families that are receiving Family First Prevention Services, there must be a child-specific prevention plan. So there's a plan that's developed in partnership with families, with children, if that makes sense, to identify what are the risk factors that are putting the child at risk of maltreatment or child welfare system involvement or foster care entry. What are the identified service needs? What are the EVPs, the evidence-based programs, and other services that might be the right response? I'm not solely focusing on the evidence-based services, but what else holistically might this child and their family benefit from? All of that would live in this child-specific prevention plan. And so somebody needs to develop and oversee that. That could certainly be a role of a community partner. Then there's the activity that's associated with identifying, the right evidence-based model that matches, child and family circumstances, making those referrals and getting families connected to services. So there's that part of the process. Then there's the actual provision of evidence-based services. Sometimes that can happen in community agencies, sometimes that's an external provider, sometimes it's a home visitor, but then who is the person that's actually providing whatever the evidence-based program is that the family is being referred to. There's also a requirement for ongoing risk and safety assessments, and just essentially making sure that families that are receiving preventive services, that the kids are safe. Now, this can be formal, it can be informal. States and jurisdictions can figure out what this looks like and how they're going to do it, but there needs to be some kind of mechanism while families are receiving prevention services that the children are safe, and there's some kind of either formal or informal, risk and safety assessments. Excuse me. For the evidence-based programs that are being provided, there needs to be ways to determine whether or not those programs are being implemented with fidelity and whether or not they are achieving their impact and intended outcomes. That goes back to that CQ line evaluation story that I talked about a couple of minutes ago. Most states, in fact, I haven't met one that hasn't, if the program is well supported, has worked to opt out of that evaluation requirement and do their own continuous quality improvement processes to be able to do that. But that's also, some infrastructure that's needed, and something that we would look for providers and community partners to be part of this continuous quality improvement process. And then there's also the data reporting that we talked about earlier. So as we think about, do I want to get involved in this community pathway game? Do I want to be a partner? These are the types of things that need to be done. And then it's figuring out who's going to do what based on whatever variation of the pathway that you might be trying to create, and figure out how you want to get families connected to services. And let me pause there because that was a lot of information, and let me see if there's any clarifying questions that folks might have.
There is a question in the chat from Kristen. The question is, can community partners just have a role identifying, determining candidacy, and doing outreach? Or does the community-based organization need to also provide the EVP service in order to be reimbursed for their work?
Fabulous question, lots in there. First, one clarification, no one but the 4E agency can determine candidacy. So take that out of the question. The actual candidacy determination process needs to be done by a Title 4E agency or the child welfare agency. A community-based agency can identify, engage, gather information, but nobody besides a state agency can determine eligibility for a federal program. But I think the meat of your question is a great one. It depends. That's the whole thing. You need to figure out what works. Like, is it going to be a community-based agency that has evidence-based providers within the agency, and within your agency you're actually doing the EVPs? Or might a role be you're charged with identifying, engaging families, co-developing a plan, working with them to make sure holistically needs are being met, but the EVP is actually being referred out to another provider. That's also possible. And how that would all work out is that, I'm going to get super wonky, so bear with me for a second. States have to develop a cost allocation plan. And in that is where they write out exactly how the costs are being determined for how they're administering their programs. So if there's parts of that where the state has to pay for this and the community agency is going to do X, Y, and Z activity, here's how we're going to determine how much that's going to cost. You can kind of outline all of that to figure out what's the methodology for how you would determine your rate of federal reimbursement. That is not the question you asked, but you would not have to do the whole thing to be part of the process. And that'd be all about determining with your agency, with your partnering agency, how you're going to do it. Are you charged with just working with the family, administering the prevention plan, kind of walking the family, making sure that they're getting what they need, but somebody else is doing the EVP? That's cool. Or, if you have some EVP providers that actually work for you in your agency and you can do all that in-house, also cool. But that's one of the places where there is a lot of flexibility, and it's about figuring out who's going to do what and what works best for your situation, for your infrastructure, for your capacity, and that's part of the design. That's part of the design process. Any other questions, kind of basic questions about that? Really helpful. I appreciate you asking that, super helpful clarification. All right, I'll keep going, but feel free to keep putting those questions in the chat. I know it's complicated, and I'd rather stop and address something rather than keep folks confused for a long time. So keep throwing in there, and I'll try to clarify. So how does a family, what does a community pathway look like? What point does it roll out for families? It can look all kinds of ways. People are thinking about designing community pathways before there's any child welfare involvement at all. How can we get in front of it before there is a hotline call and try to engage and build a prevention service plan before families ever have that experience? And there's a number of states that are thinking about trying to do that and before child welfare system involvement ever occurs. Also, can think about doing it after that initial call. Maybe there's a call to the hotline that gets screened out. It doesn't meet, doesn't meet the criteria for ongoing child welfare agency involvement, but there is indication that some kind of support would be needed. It can be referred out and step down to a community pathway, or perhaps there is an investigation. It's closed, it's substantiated, not substantiated, but the CPS process ends there. There's no reason for ongoing formal child welfare system involvement, but there's a recognition that a family can benefit from services. There could be, the onset of a community pathway at that point. And there's also others that are thinking about after formal child welfare involvement closes. So maybe there is, a substantiation, there's ongoing in-home case management, but then there is no longer a need for that, but the services the families receive might be extending for a greater period of time. How can we step down then from that child welfare service delivery context to a community delivery context? Because what we don't want through Family First and these CBPs is for families to stay in child welfare longer than they otherwise would have, only because the length of the service they're receiving extends 6 months, 8 months, 12 months, or whatever it is. So how do we think creatively about getting folks out of child welfare when they don't need to be there anymore, but still ensuring that there's a way for them to receive the services that they need? So this is a little bit reductive, but thinking about establishing access via community pathway before child welfare ever gets called, maybe after that initial call where the investigation is closed or screened out, or even later after there is a child welfare system involvement, but there's a recognition that families can benefit. You might see where this comes into play after a reunification. Like maybe there was a foster care episode, child was separated, they are successfully reunified, but families still need some help to sustain that reunification and work towards stability. That's another case in which now we would be now shifting to a prevention mindset. So just another way we think about where that might come into play. So I'm just going to share a couple of jurisdictional examples about how this is playing out, just to try to make some of these concepts seem a little bit more kind of real and concrete. So DC, first jurisdiction that had their Title IV-E prevention plan approved, long-standing history of strong community partnerships through what they call their community collaboratives. And they had a natural infrastructure already built for this community pathway approach. And it can go to two of the scenarios that I just talked about. The family can go, you usually go through the CPS hotline, maybe there's a closed investigation, nothing happens, but they realize the family could benefit, can go down to receive services from the community collaborative, or that second scenario that I'd outlined, where there was child welfare system involvement, but then that case was closed, but the family would still benefit from services, can access them through the community collaboratives. There was a very ready pathway for them. It's work that they've been doing, had a really strong community partners, and was a natural extension of their Family First prevention plan. Indiana is another one that's a little bit early out the gate with their community pathway, and they are routing theirs through their Healthy Families Indiana model. So that's a home visiting model. They are working with their home visitors to be all of those activities that I talked about earlier, developing the plan, ongoing risk and safety monitoring, all that jazz is handled through their evidence-based home visitor. Families can get access to Healthy Families either through a DCS referral. So if they come through the front door, that's one way, but then the family can also refer themselves, or other entities that come into contact with the family could refer them to Healthy Families. So there's no reason for families to go through the front door of child welfare to get access to this prevention program, but if they do, it's also an option. So there's really no, there's really no wrong door, and that the family is eligible for Healthy Families, and they're eligible. It meets their candidacy definition for the state of Indiana. So it is the assessment. So when we talk about that risk and safety assessment process and understanding the assessment of what services and supports families need through Indiana's approach, is they're using the actual assessment that HFI uses. It's my favorite child welfare acronym, the FROG, the Family Resilience and Opportunities for Growth scale. But we're trying to think about how do we not create new stuff, but use stuff that already exists. We can meet the Family First requirement. We're using the FROG. That's already what HFI does, and so it's going to meet that requirement. And then there's already a family plan through HFI that functions as the child-specific service plan. So it's already built into the model. They don't have to create anything new, and it's also checking the box of the federal requirement. Now, also just calling out though, that it's still just reinforcing that it is DCS that makes the candidacy determination, because that is inherently a governmental function. But all the information comes from HFI to fuel that decision-making process. Connecticut, transparently, it's a state that I've been working with really closely for a number of years now, has a really broad candidacy definition. When you say candidacy definition, first of all, I hate that term anyway. It's still pathologizing, but that's the words that we have. They have a very broad candidacy definition when they think about who they want to be serving via prevention services. You can see that kids with incarcerated parents, kids and families that are experiencing interpersonal violence, experiencing housing instability. They're really thinking kind of expansively beyond just necessarily substance use, mental health, or some of those more traditional identified child welfare risk factors. They are trying to move their access to prevention services as far upstream as possible. And the lingo that they use is the care management entity, or the CME, which is a community-based entity that's going to be the access point for working with families and managing their prevention services process. And back to that original question from, who was it? From Kristen, I believe. The CME will be referring out to evidence-based providers, and someone else is going to be doing that, but this care management entity is going to be coordinating that whole process. And families can get to the CME by self-referral through a number of referral sources. I'm going to shift to a visual on that in a second. The CME is going to be the one that does the assessment, determining strengths and needs, risk and safety, developing the plan, collecting all that information, sending all of that up to the Department of Children and Families for the eligibility determination. But then the actual work of monitoring, doing the service referral, the monitoring, the ongoing is going to be managed by the CME. So basically take all of that work, stick it in the community, and just try to limit the federal involvement to only what's necessary. And trying to think about how to get families to the CME is a big thing that we're working on right now, right? So there's a lot of calls that go to the child welfare hotline, right? We know that we've got mandated reporting laws, and that's where families are reported when someone suspects something. We also know that many of those calls don't need to go to CPS. Many are unsubstantiated. Many families would better benefit from a different type of response than necessarily one that would result in a CPS investigation. And they're trying to think about, how do we work with our potential referral sources to direct families to the CME when that type of response is more appropriate to what's being observed than necessarily, calling a child welfare hotline. And so in the way that this is envisioning getting rolled out is that families could go directly to the CME and go around the hotline if it's determined that that's okay. Obviously, there's safeguards built in, and if there are true safety risks of a child's in danger, then there are safeguards to go back to the hotline if needed. Families could also call their local 211 service directory resource. It's a really robust platform in Connecticut and many other jurisdictions. So 211 could make a referral to the CME based on what the family says that they need. And also the care line, that's Connecticut language for the hotline. If a family goes to the care line and they're realizing that CPS response isn't the appropriate one, the care line can talk to the reporter and say, hey, this isn't necessarily appropriate for CPS. You might want to refer the family to the care line. And so that they can go that way. It's the dotted line, because the care line is not going to call a family and say, somebody reported you, go to the CME. What they would do is send a letter to the reporter and say, thank you for your response. This type, we appreciate your concern. A CPS response is not appropriate for the family. When you see circumstances like this, perhaps refer to the CME. They're here to serve families that are experiencing these types of circumstances. Consider referring the family here, and think about us in the future. That kind of a communication mechanism. Rhode Island is another one that's similar to DC, that's looking to build off of existing community capacity. They have got a statewide network called the Family Community Care Partnership that's been in place since 2009, really great results from those services. Only 3% of families that have been discharged from the FCCPs have become involved with child welfare within 6 months, provides primary and secondary service prevention services, and is a natural partner where there's some existing capacity. And so they're looking to leverage the FCCPs by having through self-referral or other community-based referrals, to have that be the hub for receiving access to prevention services, and also thinking about after child welfare system involvement, being able to step families down. Again, like there's a hotline call, but there's not need for other involvement. We could get families over to the FCCPs. And they're also thinking about trying to serve kids that are in permanency situations, post-guardianship, post-adoption, if they're at risk of disruption, to try to then connect to prevention services to try to stabilize those homes and families. New York, very similar to Indiana, they've got the home visiting model, almost exactly the same setup that I talked about for Indiana is in play in New York. They're also trying to think about other ways, like you don't have to just pick one, right? Like jurisdictions can figure out which one or more of these work within their implementation context. And there's a lot of interest in trying to think about possibly partnerships with public assistance and trying to think about ways to more meaningfully address needs for economic and concrete supports, and also thinking about other public agency partnerships. But that's very developmental. The home visiting pathway, similar to Indiana, is already up and running. So I believe one of the resources that was distributed to you all in advance was a resource that we've developed called Considerations for Developing Community Pathways. As you might imagine from what we've talked about today, there's a lot here. So I'd encourage you to take a look at that resource if you haven't already, but thinking about how would we do this in a way that feels ethical, that feels feasible, that is responsive to what the families we serve want, that's capitalizing on the leadership and infrastructure that we have, where is there infrastructure we want to build, and there's just a lot of things to think about. How do you engage and how do you develop the partnerships that are needed to pull this off? What is going to be the process for identifying engaging candidates? How does this fit in with the vision and values of the service delivery continuum that we're trying to build? Does it or doesn't it? How are we going to communicate what we're trying to do, both within the workforce, but within mandated reporters, with families, with communities? How are we going to do the risk and safety monitoring in a way that feels, that is meeting the requirements, that feels aligned with how we want to be engaging with and supporting families in our service delivery models? Each of these things that warrants its own conversation, and that resource has a number of guiding questions and key considerations to help think about planning and structuring conversations that you might want to have if you're thinking about moving in this direction. And with that, I've been talking a really long time, and I want to pause and make sure that we've got at least 20 minutes. I've got a couple of discussion questions up here, and I'm happy to go through these if the structure helps. Also, just open the floor for questions that folks may have, and I'd like us to kind of learn from one another and as we move this conversation forward.
Thank you so much. If we can, maybe get to some of the questions in the chat and then go through some of your questions in discussion. Does that work, Dr. Thomas?
Mm-hmm.
Okay. So from Sherman, there was a question about, are there specific trainings and or certifications for community organizations who would do the EBP?
That's a really kind of good and complicated question. And the answer to that is depends. And I also want to say that I'm also not an expert in, like a clinical expert in EBPs. And so my knowledge is only going to go so far, and I want to be transparent about that. To be certified, most EBPs have a pretty strict process for how someone gets trained and certified and able to deliver them. Some are a bit more flexible. I'm thinking about motivational interviewing and, where you need to have a certified MINT trainer to a motivational interviewing network of trainers, where you need to get certified. That I would think that yes, but that there's probably not a global answer to that question, but it would be for what is the EBP or EBPs that your jurisdiction is considering implementing, and what is the process for being able to deliver them? And depending on what it is, may require its own clinical training, educational background, training that anybody could sign up for. I think that's an EBP by EBP specific decision. There's likely also training and capacity building as states figure out how they're going to implement their family first plans. They may have some kind of training requirements that they would expect any of their partners to go through, just to make sure that everybody's on the same page. And it would be incumbent upon the states to figure out what is the training requirements that they would require, and hopefully that could be something you could collectively inform or decide for what capacities and skills people need to implement the model. Excuse me. Oh, I tried to get off mute. I couldn't do it. I apologize.
There's also like a part 2 to that, in asking, are there funds available under the administrative funding to train community-based organizations to offer an approved EVP, or would they need to self-fund that? And I know you kind of touched on that. There may be some, something from the state, but that's kind of a part 2 of that question.
I muted you, so you'd have to hear me coughing, and then I forgot to get off mute. Another part of the process is that there are a number of training costs that are partially reimbursable by the federal government. And so the one thing that states do is they develop what is their Title IV training plan, where they outline what are all the courses that they're going to provide, what is the purpose of them, who's going to receive them, and certain dimensions of those are federally reimbursable. Being able to bring in partners to admit, like this could count as training to administer the Title IV plan. This would be something that you want to negotiate together. Like what is the training that you want, work with the training leadership in the state. They would then develop or make amendments to their training plan and then work with the feds to get approval. But there's a very complicated way of saying that I think there's a mechanism by which some of that could be federally reimbursed and or state funded, but trying to figure out exactly who's getting trained to do what would be a conversation to have with your state partners, and for them to think about how they could integrate that into their Title IV plan, which would need to be then approved by the feds. But assuming we get through all of the bureaucratic hurdles and processes and P's and Q's, there's likely mechanisms for some of that to be supported.
Okay, and the next question is just a clarifying question. The safety monitoring, does that have to be done by the Title IV agency?
Very, very good question. No is the answer. And realistically speaking, as states have been negotiating and working to get their plans approved, from our federal partners, there has been some concern. It is the Title IV agency's responsibility to ensure that the children that are being served through these prevention services are safe. So there is a concerted effort in the review and negotiation process that the plan that's put in place is reasonably defensible, that there is a process for ensuring that these kids are safe. No, it does not have to be done by the child welfare agency. And many states are thinking about all these folks that I showed you up on the screen, are thinking about how that role can be absorbed by the evidence-based service provider. If there's a community-based prevention worker that is working with the families that has the opportunity to engage with them and ensure that the kid is doing, that the children is doing well. It doesn't have to be. And it is important that the plan for ensuring risk and safety is clearly outlined and defined to meet to meet the level of scrutiny that is applied to those plans. Oh, that is such a very complicated question. I just went to the chat and I see the question from Linda. How do we demonstrate that children do not subsequently enter CPS? So this is one of those wonky and difficult and challenging data questions. Now, I am not gonna give you a satisfying answer because it's hard and I don't know. One of the requirements I can tell you I'll tell you what I know, and then we can see how satisfying this is. The federal data reporting requirement is that there is a unique identifier for each child that's receiving preventive services. And there needs to be that if the child was to enter foster care what their AFCARs, their adoption and foster care automated reporting system, what their AFCARs identifier would be if that child at some point enters foster care. I think this is part of the IT work that needs to be done for how are we going to track that? What is that going to look like? Where is there going to be firewalls where there's access to the data? But ostensibly, when there needs to be the federal reports of the data, the federal data reports for the kids that are receiving family first prevention services, that needs to include not the child's name, but there needs to be a unique identifier. That would be the AFCARS identifier should that child one day enter foster care. And the mechanisms of figuring out how folks are going to track that while maintaining family privacy. That is some of the sticky work that's involved in the in the design and building of these pathways. I'm sure I didn't answer your question, but that's the best I could do.
Thank you. You answered it, Dr. Tommy. So we do have, again, some more time and really appreciate the questions that you have up here. So would invite any of our participants. This is meant to be interactive. If you would like to come, certainly come off of mute. You can also engage with us in the chat. What are some ways that community action agencies might partner with child welfare agencies to design and implement community pathways to family first prevention services?
And I might take the pressure off even further, Lily, and see if there's any of these questions that are resonating. Right?
Appreciate that.
I know we've got about 10 minutes left, I think, today. Which are any of these questions sparking thoughts? Are there ways that you're thinking you might want to do this? Are there opportunities in these flexibilities that you all are finding inspiring and like you want to lean into and figure this out? Are there particular concerns, reservations? I tried not to shy away from the sticking points and the tensions and to make those clear. So are you having reservations about that? And then how do we think about equity and inclusivity if we're really trying to create an alternative pathway for prevention service delivery that does not look like the child welfare experience that many families have? How could we do that together? What's the future here that we could build? Leveraging your experience, your leadership, your perspective. What do you think? Because said differently, none of this is going to work if folks like you don't buy into it or think that it could work or that this is something that you want to be part of. And so I just love to hear where you're at, positive, negative, uncertain. And if there's any other clarification, because I realize I threw a lot of information at you and a lot of technical information, if you need to go back to any of that to help inform your answer, I'm happy to do that.
I believe Teresa.
Teresa's got her hand up. Yeah.
Mm-hmm.
Yes, I think it's a good idea. It's in New York. I'm in North Carolina now, but previously in New York, they started programs like that because they wanted less children to go into the foster care system or any kind of system outside of the home. So oftentimes when a family gets connected with where CPS, or I'm not sure exactly, each state has a different name for it. The family action response team will go in to determine whether there's a need with the family that might have caused the situation to happen, and then provide those services, connect them with those services to help them see what that situation is and if they can assist them in rectifying it so that child, winds up staying at home and providing. Sometimes it might be just a small thing that the family might need to make that adjustment so that that child does not go into the system. And the ones that do go are the ones that actually need to go. So it actually lowered the number of children in placement. lowered the number of children that went into the foster care system, all by providing that service to the child and the family within the home. So there's some, so I believe it's a buy-in, but I think that unless those services, like, okay, with us as case managers, if there's a family that's in need, maybe somehow those case managers can assist with the monitoring. If there happen to be that agency that's connected to that family for maybe another reason. I'm not sure. There are ways of tying it together. It just has to, I believe it works.
Yeah, you're exactly right, right? Like it's like there's a lot of options. It's just about tying it together, getting really clear about what are the requirements, who's going to do it, is that way responsive to your service delivery model, values, ideals, commitments, roles, capacity, et cetera.
Right.
But that's, I think, what's possible is that there's flexibility. It's just then the challenge is sorting through all that flexibility to find a way forward that works for everybody.
Right. 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 Hmm.
Just lift up in
I
the
really
chat.
appreciate you offering that. Oh, go ahead. I'm sorry.
I was going to say in the chat, I don't know if you saw that, Dr. Thomas, there are concerns about whether community-based organizations that are not the lead agency will have the capacity to serve. Is any place offering capacity building grants to the receiving agencies?
Yeah, that's a really good question. And it goes right back to that, the need to build the infrastructure for this to work well. I think that could look different. I know you guys are all over the country in different locations. I think trying to explore what's available in your areas. Is this an area where you've got philanthropic organizations that are invested in doing work in this way? Might they be partners that can invest in capacity building grants? There's been some federal demonstration grants in recent years thinking about primary prevention differently, but those are obviously small. Those are obviously being very competitive and limited. But I think it's the question. Like to start with, what are the capacities that need to be built? What are our the potential mechanisms for building that capacity? What support can we get from state partners? Are there other philanthropic organizations or other grant making entities that could do that? But just to build on, where do you want to be 5, 10, 20 years from now? And what's it going to take to build the capacity to do it? And what are all the different mechanisms that could be tapped in to help build that capacity? Because I think the good news is there seems to be a lot of energy for creating meaningful alternatives to the current systems that we have. And a lot of folks are invested in doing that. And none of it's going to be successful without the leadership and buying and commitment of people that are leading organizations like you all.
I just have a question. Why do you have to look for build a monitoring agency or an agency to monitor it?
I'm not sure I'm following your question. I'm sorry.
I wasn't sure because I thought you were saying like who will monitor it.
No, I don't think I said that.
Oh, okay. Maybe
if I did, I misspoke or I was unclear.
No, I was.
One of the requirements is that the children receiving services need to have risk and safety monitoring. That needs to be done by somebody.
Okay, in New York,
I don't know if that's what you're.
Right. So in New York, they didn't reinvent anything. It's any funding that comes, it comes from whether the state, the government, local government, things, the federal, state, and local government, right? So instead of having to figure out who monitors, you let them monitor it. It's just a program that's monitored by them. They have all the information, they have all the stipulations, and all we have to do when you have those clients or you develop a program that actually does it. Like the one that I was in is called Family Therapy and Support Services, and which was like a PINS diversion program, right? So the thing is that social services monitored it. Once a month, they would come out, they would refer clients to you or any other agency that would refer to you. It still would go through them. So they kind of would make sure that we understood everything that we needed to know and do in order to take care of this family. So they did the monitoring because they're the state. They're the ones that provide the funding. So there'd be that person that would monitor those groups of individuals doing that particular program. And so it became so much easier because you worked in line with them, you understood their system, you had all the information and background on these families, and you were able to take those families into the place that they needed to go so that they can thrive. And you won't have to worry about the backlash as far as this social services system coming back in and saying, okay, hey, what's going on with this family? Because they're monitoring. So they're getting the ins and the outs. We're following all the protocols that we're supposed to follow in order to make sure we're not doing anything wrong. And it worked out that way. It worked out really well. And it kind of took some of the inundation that's on the social services and probably in a lot of states, it took it off of them because other programs were taking that piece away and saying, hey, we'll do that for you. So that's a
I really
possibility.
appreciate that. Yeah, I really appreciate that, Teresa. And I'm realizing also that I think some of the things that you're calling monitoring, I might also call continuous quality improvement, and at least on how that's showing up in the work that my colleagues and I at Chapin Hall are doing, is working with child welfare agencies and their community partners and others like ever involved. How are we together? Like not so much like a monitoring space, but how are we together going to make sure that we're serving families in the way that we want to, that the quality of practice that families are experiencing is what we expect it to be? How do we know that families are getting the services that meet their needs and whether those EVPs are actually working for them? And so less about monitoring and more about setting up processes where we're taking a look at our current practice, understanding what's working well, what's not. Where do we need new capacity or some attention to work that better? I think in the family first space, a lot of the CQI juice got sucked up in that EBP space. Like they either needed to be evaluation or make sure that each EBP was being done with fidelity and achieving outcomes. But there's so much more of that process before we get to the EBP that we also want to look at. Are we engaging the families we want to engage? Are we developing plans with them that make sense for them? Are we getting families holistically the services that they need? And we want some kind of mechanisms to be able to track that and look at that data together and co-create ways to better serve families. And so I would say, I think maybe we were talking about that in terms of monitoring in one sense, like, are you, my contracted provider, doing what you're supposed to? I'd like to shift that lens to be more like, what are we trying to accomplish? Are we doing it? How do we know? And what kind of improvement strategies do we want to make sure that we're serving families in the way that they deserve? And to have that conversation. And that also seems to be, that is also a big part of the implementation process.
Thank you for that. Thank you. Thank you all. This was great discussion, great questions. And certainly we want to be respectful of everyone's time. But if you do have additional questions, please enter that information in the chat. A little bit later, you're going to hear about another webinar that we're going to have this month as well. But this piece, we really want to look at just a call to action. So us as local community action agencies and our state community action associations as well. For our local community action agencies, the call to action is to reach out to your local child welfare leaders and learn more about how to connect your work, right? So some of the questions that we've been asking, even relating to funding, when we're talking about even some of the training. I know that there's training, that motivational interviewing. There are things that we do in-house, right? So how can we, really just have those conversations at a local level? For state associations, inviting state child welfare leaders to a state association meeting, really to, share what is happening and the state's approach to prevention and system transformation. Again, we know we receive a lot of excellent training and technical assistance from our state associations. How can that also link in and possibly be a resource for community action agencies as a part of this work, right? As a part of this work. So that is the call to action for our local community action agencies as well as our state associations. So with that, I'm going to hand off to my colleague Karis to close us out. Thank you so much. And yes, the PowerPoint slide deck will be available.
Thank you, Lily, and thank you, Krista, for a great presentation. So as we close out today, we just want to, first, we want to hear from you. So we have a QR code here, and we'll put the link in the chat as well. So you can just quickly respond and let us know your thoughts on today's webinar. And then we also wanted to share some resources and upcoming events that we have. So as Lily mentioned, we do have part 2 of this series with Chapin Hall coming up on October 25th. And that webinar will be focusing on the concrete supports. So if you are interested in joining us for that second part of this conversation, we encourage you to register to join us on October 25th. We also have coming up the new Executive Director Institute will be October 31st through November 1st in Alexandria, Virginia. And we have a QR code there, and we will share the links for you in the chat, and they'll be in your follow-up email as well to learn more and to register for that institute. And then along with that, there will also be an Executive Director and Board Chair Symposium that will be November 2nd through 3rd, also in Alexandria, Virginia. So again, we encourage you to check that out and learn more about how to register to be a part of that symposium. You may have also seen that the Community Action Academy has a new look. So our platform has been updated and is now live. We have a guide that you can download to help you get started with setting up your new account. And if you have any questions, you can reach out to Taylor Daniel, and her contact information will be there for you. We also have our Fresh Funds. This is our latest anti-poverty resources. So the latest resources, webinars, and funding opportunities that are available. If you have not checked that out recently, we encourage you to check that out and see what's currently available. And with that, we just want to thank you all again for being with us today. Thank you so much.